should be at this time, you should be seeing the PowerPoint presentation, and we will move forward. Excellent. Okay, let me introduce myself before we start. My name is Audrey Zucker-Levin. I'm a physical therapist since 1988. I am chair of the admissions for the Master of Physical Therapy program, and it is my pleasure to be here and talking to you and telling you about our program today. I'd like to begin with a land acknowledgement. And as we gather here today, I'd like to acknowledge that we are on Treaty 6 territory, the homeland of the Métis. I'd like to pay our respect to the First Nations and Métis ancestors of this place and reaffirm our relationship with one another. I'm also a newcomer to Saskatchewan. I've been here for 7 years, so I'm really enjoying it. It is beautiful, and I'm learning to tough out the winters a bit, but I'm thrilled to be here and be part of the education process. So just as a brief overview, some things that we'll be talking about the physical therapy program here at USask. If there are additional questions, we will have time at the end, and it'd be my pleasure to answer those for you. If for some reason we don't have an answer, or if you have further questions when we're done, you can always send us an email at rsadmissions@usask.ca, and that website is or that link is also on the website for further information. So this is not your last chance to ask questions. So first, what is physical therapy? Well, it's either physical therapy or physiotherapy. It's the same thing. And we are the 5th largest group of health professionals in Canada. So there's a whole bunch of us. We are primary care practitioners. So we are the ones that people will come in and we will take a really thorough look at them. We analyze, we diagnose, we treat patients, we look for movement dysfunction, and we educate people on ways to improve health considering whatever impairment that they might have affecting their system. Because even if you have an impairment that maybe puts you in a wheelchair, doesn't mean that you don't have to do some physical fitness things. It's just that you might have some modifications that needed for those. Or if you are currently in a wheelchair, depending on your diagnosis, perhaps we can get you walking or at a higher level of function than you currently are at. So we basically do a huge assessment and determine what the best course of action is and what the goals and expectations for this patient's progress should be. There's a huge demand for physical therapy. Canada, worldwide, there will be a shortage well into the 2030s. So plenty of room for professionals. Currently, the numbers that we see, about 14,300 new job openings that might be occurring, but only 14,100 new job seekers. So there will be a consistent gap well into 2030. This labor shortage is expected to persist at this national level for quite some time. If we look at Saskatchewan specifically, the employment looks good, specifically in the northern regions, the Prince Albert region and the Regina Moose Mountain region. There is growth in the employment for physical therapists here in Saskatchewan, and we have very few physical therapists who are unemployed, and that's the people who want to work. So if you are a physical therapist and you want to work full-time, there are full-time opportunities. If you want to work part-time, there are part-time opportunities. What I usually tell people, if you're looking for an opportunity in a very saturated area, there will be a job. You might just have to take a job in a field that perhaps is not your first choice. So for example, if you want to go into cardiorespiratory physical therapy, you might have to wait some time for that opportunity to open, but ultimately it does happen. So our students always have jobs, or most of our students have jobs before they graduate, and they are in demand. So if they don't yet have a job, they've got jobs on the horizon and people are searching for them. So if you really, let's say, wanted to be that cardiorespiratory physical therapist and there's not an opportunity in Saskatoon, there might be one maybe somewhere further out, but then when an opportunity opens, you can usually jump right into it. So prospects are excellent, I should say. So there's a little video here on the value of physical therapy, and this is from the Physiotherapy Canada. So let me just play this for you.
Did you know that physiotherapists are essential healthcare professionals who offer effective treatment and prevention strategies for a wide range of conditions caused by injury, surgery, or disease? We help people of all ages return to a better quality of life. From joint pain and sports injuries to mobility issues after a stroke or a spinal cord injury. From breathing or heart problems to recovery after surgery, and so much more. Physiotherapists help restore function and get you moving again. You can find us in healthcare facilities, private clinics, and residences in communities across Saskatchewan. It's easy to find a trusted physiotherapy professional in your area who can meet your individual needs. Visit www.saskphysio.org to find a therapist near you. Put your problem in our hands and let us help you get back to being you.
Great. So once again, we are in multiple locations. Whoops. I hate when that happens. Many locations. You can find us in hospitals, in homes, in private clinics, and you name it. Also some tele-rehab, which is quite interesting. If we can't get to the patient, then we figure out a way to communicate with them. So many ways to contact. So what is physiotherapy? Well, we're grounded in movement science. We focus on disorders of movement and function. We're a very collaborative profession. We have lots of team members that include the patient in our plan of care. We are evidence-based, so the treatment that we provide is based on research. So it is based on evidence. We don't just kind of do things just to think that it might work, but we want to know that what we are doing is grounded in research. And we are really based in the life sciences, so the anatomy, the physiology, and other functions of the systems in our body and how to improve them. We do treat people across an entire lifespan. So we treat everywhere from the neonatal intensive care unit, you will find therapists, all the way to end of life. Everywhere in between, physical therapists can contact. And the beauty about our profession is that you might start in pediatrics and then you might continue to do some additional work in geriatrics or sports medicine or cardiorespiratory or anything. And it's just a wonderful profession that you can touch the lives of so many people. So the objective of the Master of Physical Therapy program is to provide the graduate with the entry-level requirements to practice physical therapy. Physical therapists are lifelong learners, so the education that you receive upon graduation will allow you to sit for the national board exam, and from there then to practice as physical therapist. If you want to specialize in a specific area, there would be additional things that you would do to gain the skills required in that specialty area. But once again, we graduate the requirements to practice physical therapy at an entry level. So we do expect our graduates to provide direct client care. That is the goal. And as I mentioned, job prospects are very good. And as I also mentioned, that many of our students have jobs already before they graduate. We have a class that's graduating in 2 months, and I've already spoken to a number of them, and they're so excited, and they have wonderful job opportunities in areas that they want to be. The program itself is based on a foundation of science. So our prerequisites, which we'll talk about in a little while, help put you to the level where you will have the foundation to jump into the science education that we are providing. The format is both lecture and lab, and we do expect our students to be with us every day, Monday through Friday. 8:30 in the morning till about 4:30 in the afternoon, give or take. That doesn't mean you are in class that entire time, but sometimes things happen and you need to add a little bit of time somewhere. So we do expect the students to be available to us. So that is a Monday through Friday, all day, that we expect our students to have with us. We use a case integration approach. So we might provide you with a case on your first day of class, probably not the first day, but somewhere within the beginning. And it might be a person who has diabetes, recently been diagnosed with diabetes. And throughout the curriculum, we might look back at this person and say, oh, now this person has developed an ulcer on their foot. And we talk about the treatment for that. And maybe further on in the curriculum, it might be 20 years later for this person, but just a year for you. And now they've had a stroke or some cardiovascular accident. And then we talk about this person and we build upon these cases throughout the curriculum. We also have 30 weeks of clinical practice integrated into our education, and I'll show you that on the next slide. So we would have 2 modules where you would be in class with us here, and then you would go out on a clinical placement sometime in April or May. And then you would come back, learn more, and then practice the skills that you have learned in your next clinical placement, and then come back. And then once again, you go out on your last clinical placement. So there are 5 clinical placements, and they can be anywhere in Saskatoon. Those clinical placements, just so we can talk about that for a second, will be in 3 discipline specific or 3 areas of physical therapy. So there'll be a musculoskeletal, there'll probably be a pediatric, and there'll probably be an acute care setting. And then there will be other opportunities, other types of physical therapy that you would be learning about. These clinicals, once again, some of them are in Saskatoon, some of them are outside of Saskatoon, and we will talk about that again in a little bit. The student experience, we have amazing students and they support each other. Once you're in, it is a supportive environment. It's not a competitive environment, but our students support each other, helping each other get through the program, making sure everybody understands what's going on. It's truly a wonderful environment. And the students who are further along in the curriculum actually tutor the students who are behind them. So it both benefits the tutors and it benefits the students who are just starting the program. We have an active physical therapy students society. They engage in lots of social events and fundraising events. Like I said, they are a tight-knit bunch of students that we are very proud of. We have an interprofessional education where there are student conferences, the interprofessional annual student symposium, where you would be working with and learning with students in other healthcare professions. So physicians or physician assistant programs, dentistry, and hopefully in the future, in the not so distant future, occupational therapy and speech pathology. We also have a student-run clinic. We have the Switch Clinic, and we have another clinic that we're starting up at the field house. And it is supervised by the faculty and run, and the students actively see patients there. So it's a great opportunity to learn from and practice the skills that you've just learned in class. So admissions requirements include our applicants must have a 4-year baccalaureate degree in any discipline. I often hear, oh, I have to be a kin major, and that is not the case. We love our kin majors, but you can be an arts major as long as you have the prerequisites. And we actually value having this kind of robust student group who are not all kin majors, but we do love our kin majors. So this 4-year baccalaureate degree needs to be from a college or university of acceptable standing. So it doesn't have to be the U of S. We take students from all over, who have been educated all over. We do have currently 3 prerequisites: human anatomy, human physiology, and statistics. We will be adding, not this admission cycle, but hopefully the next admission cycle, some additional prerequisite courses. I believe there'll be a humanities course, English, and an Indigenous Studies course. But we haven't done that yet, and we will have plenty of warning for our applicants when that does happen. Students must be residents of Saskatchewan or the Yukon Northwest or Nunavut territories, and they must be Canadian citizens or permanent residents. So we do have residency requirements for our program. I have to admit, this is probably the one requirement that students or applicants are most surprised about. So if you have any question about this, you can just give us a call. So we also have a recommended pre-application checklist, because these are sort of requirements of the students who are going to be enrolled in our program. So we call these the essential skills and attributes documents, and we ask everybody to review them. So it's aptitude and attitude, information gathering and sensory skills, communication skills, critical thinking skills, psychomotor and physical skills, and emotional health. Now, these are all things that we as a profession think are required or necessary for future physical therapists. So we put them right out front. And if you say, I've got this, then fantastic. If you think it's something that you need to work on, once again, you can give us some contact and we can talk about it. Or you can start working on those and hopefully gain those skills that we think are important. We do have an education equity program for Indigenous students, and we reserve 8 specific seats for students who are applying to this equity program. All of the minimum entry-level requirements still have to be met by these students. It's just a different avenue for our applicants. If you have any questions, just give us a call about that. So how do we select our students? So we accept, first we look at the admissions average. So this is the grade point, I'm sorry, the admissions, yes, this is the grade point average over the last 60 credits. So we look at the last 60 credits of your academic performance, and it might be 4 semesters. But if you've only taken 58 credits in those last 4 semesters, then we would have to dip into the 5th semester, and we don't pick and choose. We take all of the credits from that 5th semester. So it might be more than 60 credits that we are evaluating. But that average, that grade point average, is weighted at 60% of the admissions average. Then we also take the Casper score, which is an online situational judgment exam. So we take that at 32%, and then we have a personal statement that comes out after your application. So basically, you apply to the program, you will have registered for the Casper, which is online. They give us your scores directly. And then once we have our applicant pool that has come in, everybody gets this personal statement that changes every year. It's something about the profession, and it's going to be 300 words. It used to be 100 words, but we've increased it to 300 based on feedback from our applicants. So it's 300 words answering the question about perhaps why do you want to be a physical therapist, or why use SASC, or any type of question like that. And you will have time to provide us your answer. So the minimum grade point average, so those 60 credits, is a 75%. So you must have a 75% on those last 60 credits, or perhaps more than 60 credits, to apply or to be accepted to the program, I should say. We do use the most recent credits that are earned. And if you haven't finished your degree at the time of application, you will submit your scores to us. So that last semester still counts. So you can't blow it off. So we will be looking at those, and we will be including them in this 60 credits of grade point average. Those scores will come in around April, and then we'll make our decisions after we find that. The other thing to consider is that the prerequisite scores, so there are those 3 prerequisite courses that are required today: anatomy, physiology, and statistics. They also require a 75% minimum average just for those prerequisite courses. You can have a course that dips below 75, but the average has to be 75%. You cannot have a prerequisite course below 70%. So what we say is a 75% average, minimum 70 on each prerequisite course. So you can have a 70 on anatomy, an 80 in physiology, and a 75 in statistics to get your 75 average. There is an accommodations that you can request if that is something that you need for a disability, or if you need specifically accommodations on the Casper test, that goes through the Casper, that goes through their test taking. So if there's any accommodations, we ask that you let us know well ahead of time, and well ahead if you didn't ask for accommodations with the essay or anything, then if you have accommodations that you've had before, we ask that you disclose them before you come into the PT program, because it's easier to have them set up before you get here than to have to scramble to get them once you are here. So when we select our applicants, basically we take, you have to meet all of those admissions requirements. Even if you meet the admissions requirements, you are not guaranteed admission because we have a competitive admissions program. We take 55 students into the program every year. 8 of those students are in the educational equity program. So if we look at our last applicant pool, so 2020, 21 through 24, you could see the number of applicants exceeds and these are the number of applicants that meet all of the requirements. So all of these applicants meet the requirements, but there are more than 55 of them every year. What we do see is that with changes in our admissions, we do see sort of a decline in the number of students, but then we tend to go up. So we hover around 200 applicants for our 88 seats. The average grade point average for the students who are accepted are in the high 80s, and our Casper scores are 1 standard deviation above the mean in general, but there is a range of those scores that you can see here. Our deadline for application is December 15th. Unofficially, students will know in mid-May if they get in, if they are accepted to the program. We do have some students that are put on an alternate list. So if somebody declines the offer to the program, then we go into that alternate list, and we usually dip down to between 8 and 10 students into that alternate list. So sometimes a little bit further, it just sort of depends. You do get an official letter by the College of Graduate and Postdoctoral Studies, and that usually comes at the end of June. So we make our recommendation, we tell you what our recommendation is, but the official letter doesn't come till a little bit later. There are 2 applications. You have a College of Graduate and Postdoctoral Studies online application, and then you have a supplemental application to the MPT program so that we know that you're applying to us. You do, all students who start with us must have updated CPR, basic life support, and this will include AED education. You have to have an immunization record, a current complete immunization record. You need a criminal records check, including a vulnerable sector check to be in our program. And you need to go through a workplace hazardous materials information system, sort of an online education about that. Now, if we look at the cost of the program, this is for this 23-24 academic year. Tuition is about $23,000 for the full program. It'll be every year it gets a little bit higher, unfortunately. There are graduate student fees, which is about $3,500. This includes the health and dental and student wellness. Supplies are about $550, I'm sorry. And then you also have books. Now, as I mentioned previously, that Clinical rotations are sometimes not all in Saskatoon where our program is. If you need to go somewhere for your clinical affiliation, and most students will have to do this, let's say you have to go down to Regina, well, the transportation there, the living expenses there are on the student. Oftentimes people have relatives who live, like I'm always amazed about how the students get together. Someone says, oh, I have to go to Regina, I need a place to stay. Someone says, oh, my mom lives there, my dad lives there. And usually there are ways to fit it, but that might not happen all of the time. So you have to understand that these expenses are in addition. Is physical therapy the career for you? Well, how do you know? Our recommendation is you do a little volunteering and see what the healthcare professionals are doing. You can contact our professional organization, which is saskphysio.org. You could visit with a physical therapist and talk with them and figure out what it is that they're doing. If you'd like to connect with a current physical therapy student, we would be more than happy to help set that up for you. Or if you would like to come in and talk to some of the faculty, we would also be happy to do that. You just have to give us a little jingle. So we hope you'll consider joining the program. You can find us if you take this QR code, it'll take you to our website, I'm pretty sure. And there's probably some additional information there. Or like I said, if you have any further questions, you can actually just give us a call. You can give us a call or send us, easiest to send it to the rs.admissions email. And then from there, we make sure that the right person answers your question. So that being said, I've got some time. I'm happy to answer any questions that you might have at this time. Oh, my pleasure. If any questions come up in the future, so if you leave this and says, gosh, I should have asked this question, please do not hesitate to contact us. We are more than happy to answer any questions that you might have and help you out and maybe tell you ways to strengthen the application that you have. So I wish you all the best of luck, and hopefully I'll see you on our admissions this year or perhaps even next year.